everyone. In our last video, we spoke about the COVID vaccine and spoke about the two different vaccines, what they do, how they work. Today, we're going to be taking in all the many queries that have come along with it. Let's get straight into it. So the first question is there a correlation between age and the vaccine? Younger people seem to be having more side effects. Like I've spoken about before, the vaccine induces an immune response, which means most commonly you could have a mild fever, some chills, soreness, fatigue, tiredness, a general feeling of being unwell for the first 48 hours at least after getting the vaccine, either of them. Because younger people have a stronger immunity, this response might be slightly heightened in them. They might feel a little more weak than their parents who might just not feel much. This is just your immune response kicking in. These are not side effects per se of the vaccine, so don't worry about it. It just means you're fine. Second question. Is there a correlation between my menstrual cycle and the vaccine? Now, this is a question that has been asked very often by a lot of women to most of their doctors. There is no correlation between your menstrual cycle and the vaccine. They are two independent things. The vaccine does not affect your menstrual cycle in any way. It does not delay it. It does not prolong it. Your bleeding is not going to be heavier because of the vaccine. And it's most certainly not going to cause any infertility or any of these other issues that you've been reading about through all the conspiracy theories. It is perfectly safe in women. There are a lot of factors that could cause imbalance in your menstrual cycle. One of the biggest factors is stress. You could also have hormonal issues, which you could get checked for. But stress, of course, we are living in very stressful times. All of us are going through a lot of uncertainty of life, of the vaccine, whether I'll get it, whether I'll be unwell after taking it. So all of these things could also cause a little up and down in your menstrual cycle. The vaccine per se has nothing to do with it. It could just be an incidental finding that, you've been delayed, or maybe you've had a heavy flu or things like that. But there's no actual correlation between the two. So don't worry about it. You can take the vaccine even if you are menstruating. You don't have to not be menstruating to take the vaccine. That's another thing I wanted to let you know. Now, who can take the vaccine? As of today, everybody above the age of 18 is eligible to take the vaccine. This vaccine, for ethical reasons, has not been tried in the pediatric age group, in children, which is why we have not yet approved of it in our regular immunization schedule that we do have in pediatrics. But everybody above the age of 18, all adults in the country, most certainly you have to and you can take the vaccine. Now, in case you have severe allergies or very severe allergic responses to certain stimuli, or if you have bleeding or clotting disorders, you have to be careful while taking the vaccine. Please speak to your physician, your doctor, before taking this vaccine, and you might need some more medical attention. Everybody else, whether you have blood pressure, diabetes, any other issues, medical issues, speak to your doctors, but most certainly, yes, you can get vaccinated. We've seen all our patients above the age of 60 who've taken it, and there have been no side effects whatsoever in them, so go right ahead. Now, can pregnant and breastfeeding women take the vaccine? In India, the Ministry of Health and Family Welfare has not approved of the vaccine for children and pregnant women. However, the National Body of Gynecologists and Obstetricians has recommended the vaccine, both the vaccines, for pregnant women. Now, why the conflict? Of course, for ethical reasons, children and pregnant women, breastfeeding women were left out of initial trials for the vaccine, so we haven't really tested it. But we do give pregnant women a lot of vaccines the inactivated flu vaccine, the regular flu vaccine, is given on a pretty routine basis to them, along with a few other vaccines which are safe. A dead vaccine like the Covaxin is considered safe even in pregnancy because it's not going to replicate in you. The virus will not replicate inside of you because it's dead. So that is why the National Body of Gynecologists and Obstetricians is saying that it is better for them to get vaccinated and have an immune response, because in these age groups, in pregnant women, in breastfeeding women, the immunity is slightly lower and the effects of COVID in them are much more disastrous. So on the safer side, the recommendation is that they should get it. However, please remember that we would always want you to make an informed decision. The vaccination is not mandatory on anyone. It is a voluntary decision. You can choose to take it. We recommend you take it, but ultimately the decision is up to you. Is it safe for pregnant women to take it? Please speak to your doctors also, but as far as the recommendations go, it is. What about breastfeeding women? Now, when you are breastfeeding, it is the best form of food for your baby. We encourage exclusive breastfeeding for the first 6 months of a child's life. When you are feeding your child, the antibodies that are generated inside of you also get passed on to your child, which could protect the child also from future COVID infections. So that also is an added benefit, apart from, of course, the immune response that will be generated in you. So again, it is recommended that even breastfeeding women take the vaccine. Now the next question is, do I have to take a booster dose apart from these 2 doses? Now, as of now, both Covishield and Covaxin, it is recommended that you have 2 doses 6 to 8 weeks apart from each other. Both doses should be of the same vaccine. There have been reports that have recommended a booster dose because the antibody response might not last beyond 6 months, but there's no concrete evidence yet, so we haven't recommended it. It is imperative that everybody gets vaccinated because apart from the social distancing, masking, lockdowns, the only way to break the chain is to give everybody that immunity and that strength to fight off future infections. That is only and only possible by vaccination. This is how the other countries have been overcoming this problem, and it is our turn and we need to do it, and we need to do it on war footing. I do understand that we are a lot of people. We are the biggest vaccination drive in the world, but we have to keep at it, we have to be patient, and we have to do our duty as citizens of this country by taking the vaccine. Now the next question, and this is my favorite one. Do I have to take any special precautions regarding the following after taking the vaccine? My diet. No, you do not. You don't have to eat less spicy food. You don't have to eat less oily food. That would be great for your health. But there is no correlation between what you eat and the vaccine and your immune response. You can eat your regular meals. That's absolutely fine. Is there any correlation between alcohol and the vaccine? No, there isn't actually. You could stop drinking, but you could also celebrate your vaccine by having a drink or 2 in your house by yourself, not in a pub with your friends. Is there any correlation between smoking and the vaccine? Again, no, there isn't, but smoking does increase your risk of blood clots in general, apart from, the viral infection itself. So it would be ideal to not smoke during this time, but scientifically speaking, there isn't any correlation between smoking and the vaccine and its immune response. Now, last question. Will I get blood clots after taking the Covishield vaccine? Now, I've tried answering this question a little bit in the first part in our vaccines video. I'm going to answer it in detail now. There have been reports that came in from Europe in March 2021 regarding life-threatening blood clots that were reported in people who took the AstraZeneca vaccine, which in India is the Covishield vaccine. Now, the UK did study this. They did a detailed review of whether there is an actual correlation between Covishield, between AstraZeneca vaccine and the blood clots, or was it just an incidental finding? They did not find any proven link between the two, one. And secondly, they also noted in a separate review that the benefits of taking the vaccine far outweighed the risks of not taking the vaccine. Now, what does that mean? The vaccine itself will give you immunity to prevent COVID infection. The risk of blood clots, however, was found to be 4 in 1 million people, which means the risk was 0.0004%. However, actually getting COVID infection, which also is a very big factor causing blood clots in the patients because of the inflammation that the COVID virus does cause. The risk of blood clots from COVID infection goes up to almost 20% in people. So there's 0.0004% on one end and there's 20% on the other. So obviously it is safer to get this vaccine. Secondly, there isn't any proven link between the two. Now, there are a lot of independent factors that cause blood clots in your body apart from this COVID virus. High blood pressure, diabetes, smoking, cancer, or even women who take oral contraceptive pills. So these are high risk for COVID any which ways, because the COVID virus added to the mix of any of these would anyway put you at high risk for having blood clots. The COVID vaccine itself does not have that higher risk as compared to all these others. The risk of blood clots after smoking is 0.2%. The risk of blood clots after COVID infection is 20%. And the risk of blood clots after taking the AstraZeneca vaccine is 0.0004%. Now I understand that it is very easy for us to believe negative news about the vaccine because there has been a lot of hype about this vaccine, about it coming out, and we were looking at it to save us. But there is a lot of fear inherently in all of us about the virus, about the vaccine. Now I understand that it's very easy for us, given the situation around us, to believe this negative information about the vaccine or about anything in general. Because for starters, all of us were living in this hope and anticipation of the vaccine coming out and it, helping us fight off this virus completely. It was going to be our savior, so to speak. And secondly, we've all been living in a state of fear and anxiety and uncertainty for the last 1.5 years almost. So when negative news reaches us, our mind tends to believe it when it is in this mental state, and it's easier for us to fall prey to misinformation. Please fact check your information and believe your doctors and your scientists when they are presenting scientific facts in front of you. And if nothing at all of us frontliners were given Covishield and Covaxin. The ones who've taken Covishield are standing hale and hearty in front of you. So the results are there itself. In case you are still worried, please remember, in India, vaccination is not mandatory. It is a choice, and it's the right choice to make. And you have a choice between 2 vaccines. If you are still not comfortable with Covishield, you can go ahead and take the Covaxin. But I do urge you to please get vaccinated so that you can help all of us break the chain of transmission and get immunity to this dreaded virus. This is all we have for today, but in case you have any more queries, anything at all, don't worry about what it sounds like. Nobody is judging you. Do write into us. We are thesafetynet.in on YouTube, Instagram, and Facebook. We are pretty active on social media and keep posting about COVID-19 and various other healthcare, health-related, medicine-related issues that people have. We love hearing from you and do write into us. We are here to help you. Until next time, do stay safe and stay healthy.